Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy, and we will discuss why body planes matters in medical imaging and medical coding. I'm sure you already know about the body planes because that we have already discussed in our last session. So you can say that this session is in the continuation of the same, where we are going to mainly talk about medical like we are going to talk about why it really matters for medical imaging and medical coding. Okay, so in this session we will go in the same way. Like firstly I'll give you the answer of this question, we'll explain you the definitions, and also we will see some great example that will help you to understand why it is really matters in the medical imaging and medical coding. Along with that, I will also provide you some interviews, questions, tips and tricks that will help you to remember these concepts for a longer go. Okay, and at the end I'll also provide you some questions that is related to interviews. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being we are just mainly focusing on why body planes matters in medical imaging and medical coding. But prior to that, if you don't know what are body planes, then things would be difficult for you. Okay, so that's why I strongly suggest you to go and check out the previously released session first. Now I want to tell you that if you want to refer all the content sequentially, you can also refer the Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content. And in case if you want to ask any questions on it, you can reach out to me through comment section. Okay. All right. So let's get started and see why body planes matters in medical imaging. So firstly, we will be talking about the medical imaging. We'll try to understand why it is so important for the medical imaging, because here I'm noted down body planes are critically important in radiology and diagnostic imaging. Okay, so it is very important for both radiology and diagnostic imaging. First point says CT scans and MRI scans are taken as a series of slices through the body, and each slice follows one of the standard plane. Okay, so whenever a diagnostic team perform a CT scans or MRI scan, then a series of slices, okay, multiple slices, imaginary slices gone through the body, and each slice follows one of the standard plane. Okay, so that's why if you don't know about the standard plane, then how you will perform these operation, because you will not be able to interpret it correctly if you are not aware what are body planes. Okay, therefore it is mentioned that a radiologist must identify which planes an image was taken in to correctly interpret anatomical structure. Okay, very important. The next thing is common imaging planes orientation. Yes, so these are some common plane orientation that we have to follow. Like first is axial, that is transverse image, the most common plane used in CT and MRI. Okay, shows a slice viewing looking up or down through the body, like slicing a loaf of bread into round slices. Okay, so this comes under a axial or transverse images. Second point says sagittal images, commonly used in spine and brain MRI, shows a side view. Okay, so it is mainly used to show the side view. Okay, so let's say if any particular patient is there who is suffering from some disease related to spine or brain, then in that case some sagittal images will be used to show a side view. Okay, but again these things totally depend on the requirement as well as the expertise of the doctor, so they decide like which one to take. But yeah, there are some common things, that's why we are discussing it. Okay, the third point says coronal images. Yes, commonly used in brain, chest and abdominal imaging. Okay, so when we are going to perform some tests related to brain, chest, abdominal imaging, So you can see brain is used here also and here also. So it depends, as I mentioned, like it depends on disease and the type of scan needed. Okay, so don't get confused here. So it is also commonly used in brain, chest and abdominal imaging just to show the front view. Okay, so these are the most commonly used plane orientation, and according to that we perform the operations. Now you can see here I have noted down a very important line. Modern CT scan and MRI scanners can actually reconstruct image in any plane from the originally acquired data. Okay, it has that capability, and that is called as multiplanar reconstruction, MPR. But the three cardinal planes remain the standard reference views used by the radiologist. Okay, so now we have modern devices for CT scan, MRI scan, so it can like reconstruct the image in any plane from the original acquired data, right? And this thing is called multiplanar reconstruction, but the three cardinal planes remain the standard reference views used by the radiologist, so they will refer that thing only. Okay, that's why it is very important to know about we should have knowledge about the body planes to get this answer, why to perform these kind of operation. And I think now you got this answer why body plane matters in medical imaging. Now moving ahead, we'll talk about why it really matters for medical coding. Okay, so here I have noted down the things. So you can see body planes are also important in medical coding like CPT, ICD and PCS. So let's see one by one how it is used. So first is radiology CPT code. Yes, radiology CPT codes sometimes specify the plane or views taken, like X-ray, spine, two views may include AP or lateral views which relate to the coronal and sagittal planes. Okay. Second is surgical approach description. In operative reports often reference planes, for example describing an incision as being made in a particular plane direction. Okay, so when they are going to study about the surgical approach description, so they should know because it is referred there as well. Okay, body planes are referred there also, just to describe the incision or kind of cut that is made by the experts. Okay, so understanding the planes help coder correctly interpret the radiology report and operative note to assign the most accurate code, because if they are not aware of the body planes, they will assign wrong code and it is not expected from them, right? So that's why it is very important that they should know about the body planes. The next thing is in ICD-10 PCS, the procedure coding system used for inpatient hospital procedure. The approach character of code can relate to the plane or direction through which a body structure was accessed during the procedure. Okay, so that's like these are the all reason that clears that why it really matters in medical coding. So I think now you have idea of both why it is important for medical imaging and medical coding. Now I'll give you some pointers that will help you to remind all the things or conclude all the things that we have learned so far. The first point says body planes are imaginary flat surfaces that divide the body into section. Planes provided a standardized views, a way to describe the direction of cut, views and images. Okay. Third point says all planes are based on the body in anatomical position. There are three cardinal planes: sagittal plane, frontal coronal plane and transverse horizontal plane. And each plane are perpendicular to each other, like x axis, y axis and z axis or z axis. Okay, so each plane corresponds to a pair of directional term already learned, like sagittal for medial and lateral. These things we already discussed, right? Frontal coronal, anterior posterior, transverse superior inferior. Now like you can see these are the terms, but we have a detailed session for these each term, right? Anatomical terms of direction. So if you are those who have watched the session, they can relate the things easily, correct? That's why I'm saying follow it sequentially. Then a plane is imaginary concept. A section is actually resulting image and a slice. Body planes are essential in radiology like CT, MRI, X-ray interpretation. Body planes are essential in medical coding for interpreting radiology report, operative report and assigning the accurate procedure codes. Okay, so I think now this session is clear to all of you, where we discuss why it is why why the body planes are plays important role in medical imaging and medical coding. Now for today there is one question for all of you: what are body planes? Because if you are not aware of this question, things would be not easy for you. You might get confused. That's why I'm sure you know the answer of this question, so please do share your knowledge in the comment section, because it will help you to recall your topics in timely manner, because you are preparing for jobs and interviews. Also it will help those who are not aware of the answer. Okay, so what they can do, they can simply refer it through the comment section. Additionally, like when you write the comments in the comment section, it will instruct me that you guys are learning from these series, and according to the comment number of comment, I will release the more sessions for this playlist. Okay, so yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.